Feature question 5. While observing a patient's gait, I saw a man walking like Grandpa McCoy. Grandpa McCoy was a character in a 1950s TV show starring Walter Brennan. Walter Brennan was Grandpa McCoy, a show called The Real McCoys. And what the person saw this gait was during his left foot plant, he leaned to the left and his right shoulder elevated. Which muscles are weak? So the patient had stepped on the left foot plant, and he leaned to the left as he walked. Left foot plant, lean to the left. Left foot plant, lean to the left. Here's the posture of a weak left gluteus medius, which is one of the two muscles which can cause this gait pattern. The patient's typical posture is high hip, high shoulder, and high occiput on the left side. When there's a left gluteus medius weak, the patient will compensate for that by having their whole body shift to the right, to the left as they walk. So the body may be like this standing, but when the patient walks, they will shift to the opposite side to kind of compensate for this gait pattern. The patient will typically show a Trendelenburg sign on the left if that's really a bad weakness of the muscle. So this is when the Trendelenburg on the left is when the patient puts their weight on the left foot and lifts the right foot. If the gluteus medius is weak, you'll see a pattern where the gluteus medius will just give out. The patient stands on the left foot, and the patient will tilt even further down to the right as the gluteus medius is unable to support the left iliac crest and hold it in the left position as the patient shifts the weight to the left foot. So the pelvis will shift even further down on the right and up on the left in a Trendelenburg sign. The associated compensatory gait to this pattern, where the patient is doing the so-called Grandpa McCoy gait, or every time he puts the left foot down, body shifts to the left. And you've seen people like this. You can watch them going down the street, or watch them in the airport, or watch them walk in your office. This compensatory gait pattern is called the Trendelenburg gait, or the Trendelenburg lurch, or sometimes the gluteus medius gait is what we call it, or a Grandpa McCoy gait for those who are old enough to remember that show. Now, the gluteus medius will create a Grandpa McCoy gait, a lateral hitch to the same side as the weakness, the same side as the ipsilateral elevated hip and shoulder and occiput. Patient may have hip pain or greater trochanter pain or low back pain. These patients could be related to the prostate, meaning the prostate lift challenge and technique, or uterus, if it's a woman, uterine lift challenge and technique. Many years ago, I had a next door neighbor who was walking around his yard, and I pointed to my wife. I said, he's an older fella, and I said, look at that guy, look at our neighbor. I said, look, he's walking. He's got a Grandpa McCoy gait. He's got a gluteus medius gait. I said, I bet he's got some problem with his prostate. Interestingly enough, unfortunately, the guy got prostate cancer, showed it up about a year and a half later, and died of it about a year after that. But you could just tell by his gait that there was a gluteus medius weakness, and that keyed me to look at him and think, the guy is an older guy. A lot of older guys have prostate issues. I said, I bet he's got a prostate problem, and unfortunately, it was a fatal prostate problem in his case. But I did see it a year and a half ahead of time by just watching the neighbor walk down the street. High gluteus maximus. Left gluteus maximus would have a high left hip and anterior rotation, similar to the gluteus medius with a high left hip, but the buttock will kind of rotate a little more anteriorly. And you can see that if you look down from above and you look at the patient, their buttocks is a little more anterior on one side than the other. So this patient will have a Grandpa McCoy gait, but a backwards hitch. They'll be if it's the left side, they'll step on the left side and go laterally, but they'll step on the left side, go laterally and back, go laterally and back, laterally and back. And so you see this kind of pattern also in people. They'll often have low back pain. There could be often an origin insertion injury with the trauma that caused that low back pain. And these patients who have that will require localized origin insertion technique, and their back pain sometimes is still present after you've done everything else, and you check and they still got a gluteus maximus and it TLs down area along the iliac crest origin or sacroiliac origin. When you do origin insertion, that it usually takes a lot of their back pain out. Something that's oftentimes missed because it's just one section of the gluteus maximus has an injury, and they'll bend over and say, it hurts right there, doc, and if you check, that's where the origin insertion injury is. These patients will have difficulty or back pain going upstairs because of the nature of the gluteus maximus function. And as we know, gluteus maximus bilaterally causes weakness, causes hyperlordosis, and sort of abdominal weakness causes hyperlordosis. And a bilateral gluteus maximus is related to an applied kinesiology upper cervical fixation. And once again, uterus and prostate. And remember one other thing about the gluteus maximus. These patients have the gluteus maximus inserts into the iliotibial band, and that can create some lateral knee problems as well. Dr. McCord.
I just wanted to make a comment that although this was discussed in QA session 2, it's also in the QA Muscles workbook. Those workbooks are available at QA session 1 in the session downloads area. And there's 95 pages of notes that go along with the QA course that if you haven't availed yourself of those notes, you can print them out, or you can just take them onto your computer as a PDF file. Whatever the case might be, know that they are there, and this information is in those notes.
Thanks, Gary. They are a good resource. They're really, I actually look at them myself sometimes.